Neevita Narayan. I'm an audiologist and speech therapist. I'm a director of Sphere Speech and Hearing Clinic. We have different branches, main branch being in Delhi at Lajpat Nagar. We have one in Noida, Patna and Gurgaon. Today I'll be talking about deafness in children or hearing impairment in children. You all will be surprised that the incidence of deafness in children is very high. It is much higher than other congenital problems. It is 4 in 1,000, which is quite a high number. And all these babies are missed out. Only when they don't develop speech, they come to us, and then we find that they have a hearing loss. Now, by that time, it is quite late because they have lost the critical period of treatment. So, it is very important that we pick up these babies at birth. Another thing, you'll be surprised to know that deafness can be picked up at birth. We are involved at hearing screening at various hospitals, various birthing centers, wherein we screen babies for hearing loss within 48 hours of their birth. They can be picked up. As per the World JCIH, there is something called 1, 3 and 6 golden rule, which means by 1 month we should be able to diagnose, not only detect hearing loss, we should be able to diagnose them. By 3 months we should be able to fit the hearing aid, fully diagnose and fit the amplification device if at all they have hearing loss. And by 6 months we should enroll them in a speech and language program. Then only we can eradicate deafness. In Western world, they're able to achieve. All the babies born are screened for hearing test. Like for other testing, thyroid and other testing, hearing testing is a must at birth. So after the babies are screened for hearing loss and we find out within 48 hours that the babies have referred the screening test, then the question arises in the parent's mind, what's next? Where do we go next? Ideally, they should be going and visiting an audiologist who would be conducting a series of audiological tests to find and confirm the type and the degree of hearing loss. So it is important to know just whether the child is having a hearing loss or not. It is also important to know how much is the hearing loss and what type of hearing loss it is. Hearing loss is of various types. It can be because of middle ear infection, it can be because of various middle ear infection, diseases, or there can be a permanent hearing loss which is caused by hearing nerve. To find the type and degree of hearing loss, one test is not enough. No one can just conduct one hearing test in an infant who is 2 months old or 3 months old and confirm the diagnosis of hearing loss. Generally, these children, these babies have to undergo battery of tests. And why we do a battery of tests? Because these babies cannot say this is the amount of hearing loss I have. These are the sounds I am not able to understand. They are not even speaking at that time. And we are trying to figure out how much is the degree of hearing loss and the type of hearing loss they have. So it's but obvious that we have to do various types of hearing tests. It's like a puzzle. So we have to kind of pick up each and every pieces of puzzle to decipher the hearing loss. Because babies do not tell us that this is the type of hearing loss they have. These are the sounds they are understanding. These are the sounds they are not understanding. And hearing loss is not of one type for everyone. There can be a sloping hearing loss, there can be a profound degree of hearing loss, there can be a moderate, there can be a hearing loss only for high frequencies, there can be a hearing loss only for mid frequencies. So we need to know, and how do we know in these babies? We can only know if we perform a battery of tests. Different test gives us different piece of information. Now, if we do a BERA, Auditory Brainstem Response, ABR. Now that is a test that tells us the conduction of auditory nerve and at what level the nerve is conducting. In ABR also, There are various types of ABRs. We do tone burst ABRs, we do click ABRs, we do chirp ABRs. All the different type of ABRs gives us different information about different frequencies of hearing loss. Then we do ASSR, which is more frequency specific. It gives us information of the degree of hearing loss at different frequencies. Then we do otoacoustic emissions to check, which is also done at the time of screening. It tells us the functions of outer hair cells in the cochlea, that is the inner portion of our ear. We do tympanometry. It is important to do tympanometry to find out the status of middle ear. It is very important because in children, many a time, in babies particularly, the hearing loss can be because of middle ear infection. So it is important to rule out middle ear. We cannot find out the degree of hearing loss without knowing what type of hearing loss the child is or baby is having. It is important to consolidate all bits and pieces of information to give a clear picture to a parent. Then only the treatment can be based on that. Unfortunately, for hearing loss, based on one test, we cannot conclude. So that is why in infants or in babies, we need to have battery of hearing test. Then the tests are objective of type and subjective type. In objective test, we do not require the participation of babies, whereas in subjective test, we require the participation of babies. We should never conclude based on one or two objective tests, because the objective test can have artifacts, machines can be may not be working, and your test and babies are anyway not going to respond because they are not responding in objective test, so your test can be inconclusive. You should always collate the objective test along with the subjective test, and if both the tests are giving the same information, then only you can conclude a hearing loss, a type and degree of hearing loss in small babies and infants. Subjective test are examples of subjective test are behavioral observation audiometry. In behavioral observation audiometry, we take the baby in the sound booth and we give various type of sound stimulus. It can be noisemakers, but it is measured that what is the amount of sound or what is the level of sound that we are giving, so that we can look at the baby's reaction when we are presenting the sound stimulus in the room. There are two clinicians involved in behavioral observation audiometry. There is one clinician who is outside the testing room where he or she is testing, and there is one clinician who is trying to distract the baby and working with the baby, who can look at the response of the baby much more closely when the stimulus is presented. So when we do the objective and subjective test together, we come to a conclusion that this is the type and level of hearing loss baby is having. It was great interacting with you all on hearing loss in children and how we can diagnose them. If ever you want to contact me, I am Neevita Narayan from Sphere Speech and Hearing Clinic, based in Delhi at Lajpat Nagar and Noida, Gurgaon and Patna. If you want to contact me, please contact lazoi.com and you can book an appointment for me. Thank you so much.